Hello to the world. I am Asian Doctor. Welcome to my channel. I discuss the most common diseases and problems in our everyday life that we face, and we need a quick remedy for that before taking the patient to the hospital. So, today, the disease that I want to discuss with you people is about the failed pregnancy, which you may call it ectopic pregnancy in a medical terminology. Before really going into the detail, I would like to give that a brief review that we know that the baby is normally in the uterus. The baby's home is uterus. The baby loves to live in the uterus. If fertilization when occurs and the developing baby is not in the right place, that means is in uterus, then you call it the failed pregnancy. But there is a greater chances that the failed pregnancy or the ectopic pregnancy, most commonly the location is the fallopian tubes. Actually, you have to confirm this by a few signs and symptoms that it is really the ectopic pregnancy, or it's just the hydatidiform mole, or it's the threatened abortions or incomplete abortion. These are just different cases which your doctor should have in mind before going and labeling it as ectopic pregnancy, right? The first three signs that you may see in ectopic pregnancy is when you have a secondary amenorrhea, when you have a unilateral abdominal or pelvic pain and vaginal bleeding. This means the first point that I said is the secondary amenorrhea is when there is a lack of menses. When you have no menses, secondary we call it in the sense that you have a proper menses prior to this pregnancy, and now it has stopped, and it is now you have no menses, but you have abdominal pain and you have vaginal bleeding. These three things are very much more important in order to consider for the ectopic pregnancy. When this is an emergency, right? Your ectopic pregnancy might be ruptured or it might not be ruptured, but this is an emergency. And sometimes when it is ruptured, the bleeding is so much that the patient is having the hypertension and tachycardia as well. Tachycardia means when there's an increased heart rate, it will indicate that there is a significant blood loss. You must have to keep in your mind about the signs and the symptoms in your mind, not the signs actually. You must have to notice about the symptoms. For this, you have to take your patient to the hospital, and you have to investigate. You have to investigate for the beta HCG test. It will be positive. An ultrasound, it may or may not reveal a mass. But more significantly, no intrauterine pregnancy will be seen, which is, I have told you earlier, the babies love to be in the uterus. It don't want to be anywhere else. If the baby is anywhere else, you should keep it in your mind that you have not a normal pregnancy, and it is called a failed pregnancy. You may call it, but in medical terminology, it's called as ectopic pregnancy. Actually, when you do the beta HCG test, obviously, no doubt it will be positive, but the value will be greater than 1500 milli international unit. When there is a failure to see that there is a normal, there's absence of a normal intrauterine gestational sake when the serum beta HCG level is greater than 1500 milli international unit, it's actually a sign, it's actually an indication that the patient is having ectopic pregnancy, or God forbid you have ectopic pregnancy. Actually, the pregnancy, as I've told you all earlier, that when it is unruptured, is when you notice that the beta HCG level is greater than 1500 milli international plus with a no intrauterine pregnancy is seen with the vaginal ultrasound. Let me tell you that what might be the causes. If you're a patient, you ask, why am I only the reason that I have ectopic pregnancy? No, there might be an underlying problem which you are facing due to which you are facing the ectopic pregnancy. The main causes are when you have infections, for example, the pelvic inflammatory disease, which is way more common in women, way more common. When there's a post-surgical, like for example, if you have done your tuboplasty or you have done your tubal ligation, it might be the cause for your ectopic pregnancy. When it is congenital, for example, your mama has taken the diethyl stilbestrol and you have the exposure to that. Sometimes, not most of the time, but sometimes it is idiopathic as well, which means that there are no risk factors, but still you're getting that, right? Um, let's go to the treatment, but the treatment will be from two aspects, I guess, because one patient is having the unruptured ectopic pregnancy. Her management is very much different from another patient who is having a ruptured pregnancy, right? Remember one thing, that before going for the failed pregnancy or ectopic pregnancy, you first confirm it that you might not be having the hydatidiform mole. For this, your doctor will do the ultrasound, and on ultrasound, if there is the intrauterine pregnancy, then the management will be based on the findings. For example, if the diagnosis is the hydatidiform mole, which is that there is no baby, there are just tissues in the uterus, and there is no baby, and it needs to be removed, right? Because there is no baby right in there. In the hydatidiform mole, the patient should be treated with a suction curettage. That is a surgical procedure in which the tissues are removed surgically, and after that, it should have a weekly basis of a beta HG test, because this will be the follow-up plan for the patient. And if there is a possible ectopic, when the ultrasound, for example, there is no gestational sac, we also call the baby is not in the uterus, but the quantitative level of the beta HCG is greater than 1500 milli international unit, it is impossible to differentiate a normal intrauterine pregnancy from an ectopic. Why? Because beta HCG levels in a normal intrauterine pregnancy doubles around about every 58 hours. The appropriate management will be to repeat the beta HCG level and the vaginal ultrasound every 2 to 3 days, until and unless the beta HCG level increases from 1500 milli international unit. With that information, an ectopic pregnancy can be distinguished from intrauterine pregnancy. Okay, coming towards the unruptured pregnancy. Here the management, we have two options here. Either we go for the medical treatment or we go for the surgical option. Medical option is actually we have to give folate antagonist. What I do mean by this, that for example, brand name methotrexate, when we give this, the folate antagonist actually attacks rapidly on the proliferating tissues, which include the trophoblastic villi, which are very much important for the baby, right? For the baby blood circulation, the waste removal, etc. The criteria will be that when the pregnancy mass, when the baby in your term is less than 3.5 centimeter, and when the beta HCG level is less than 6,000 milli international unit, and when the baby has no fetal heart motion, and when there is no history of a folic supplementation. 90% it is successful when you take a single dose 1 mg per kg. Actually, the patient, once having the unfortunately ectopic pregnancy, she might be having the second time as well. This is not good. For this, what should you do? You should do for serial beta HCG levels to ensure that pregnancy is resolved. When your beta HCG level are decreasing, it means that you are free from that when you take the medical treatment. Remember this. After this, the patient should be given RH negative. If the woman is RH negative, she should be given the ROGAM. The other is laparoscopy. It should be only done when the patient does not meet the criteria for methotrexate. When, for example, when the beta HCG level is greater than 6,000 milli international unit, when the baby fetal heart is there, and when the pregnancy mass is greater than 3.5 centimeter, the preferred procedure for this will be salpingostomy. Excuse me. What do I mean by this? Salpingostomy is a procedure in which all the tissue from your fallopians will be removed surgically. And ischemic tubal pregnancies are also done by segmental resection, in which the tubal segment that was having the baby or the tissue, it is resected. Salpingectomy is another procedure. It is reserved for patient when she has a ruptured ectopic, or the other women who don't desire for further fertility. After a salpingostomy, beta HCG levels should be obtained on a weekly basis to make sure that there is a resolution of the pregnancy. RH negative women again should be administered with a ROGAM. Remember one thing, when you know that unfortunately there is a recurrence rate means that you might be having again and again the ectopic pregnancy. You should go for the follow-up. The patients who are treated with the methotrexate or salpingostomy should be followed with the beta HCG levels to ensure there has been complete destruction of the ectopic trophoblastic villi. That's all for today. I hope it would help you a lot. Please subscribe to my channel and give a thumbs up, and thank you to all the viewers for your positive comments and likes. Thank you so much. That's all for today. Have a good day. Bye.